Main camera is right there, but you can look at me and we'll have a chit-chat here in a moment.
I might have to.
Beaches and pools. There you go. Beaches and pools will be packed this weekend, right? With temperatures in the 90s. Time to slather it on the sunblock. And here with some sunscreen safety tips is Dr. Shirley Stickle. She's from Palm Beach Children's Hospital. Good to see you. Thank you.
Good morning.
Thank you for coming in. You know, sunscreen is one of those things, if you don't reapply it often, it doesn't do you much good.
That's correct. If you don't put it on appropriately, it won't do the job that it needs to do. If there's a few things you can do to make sure that you are applying it appropriately.
Okay.
First of all, you have to put it on 30 minutes before sun exposure. That way it has a time to sink into your skin.
Put it at home. Put it on at home before you go out.
Correct. Put it on at home. And don't be afraid to be generous with it.
Right, okay. And that's a problem. A lot of us probably aren't using it correctly.
That's true, yes.
That stinks.
And the other thing to help with applying it appropriately is making sure that you put it on frequently.
Right.
Reapply every 2 hours.
Okay. Should we use it if we're indoors or just strictly outdoors?
Strictly outdoors before sun exposure.
Okay.
Yeah.
All right, so you're at the beach. You've done it right, put it on a half hour ahead of time. You jump in the water, you're in there for 15, 20 minutes, you get out, reapply?
Reapply. Reapply anytime after swimming, after toweling off, after sweating.
Okay. Now, what kind of SPF should we look for?
A minimum of SPF 15.
Okay.
Anything above 50 has not been proven to decrease your risk.
Okay, you know, that's what I've always told people. It seems like after a certain point, it's overkill. You see 70% or whatever. So, you know, somewhere between 15 and 50, you should be okay. The trick is to reapply often.
That's correct.
All right. Okay, so the FDA is now proposing some new sunscreen safety standards. It only approves 2 ingredients that are safe or good, titanium dioxide and zinc oxide. Why these 2 products? How do they work?
These are considered mineral sunscreens, and what they do is they reflect the UV ray away from the skin. It's actually a physical barrier.
Right. Zinc oxide, I think a lot of people are familiar with it. You know, it leaves like that white residue all over your face. Is it the same thing with titanium dioxide?
It's a little bit clear. It's not as thick as zinc.
Not as thick?
Yes.
Okay, all right.
But they're both very effective.
Okay, we've already covered the minimum that people should have. All right, your child, okay? So a lot of times the kids are bad about reapplying.
Yes.
They don't want it, it's sticky, whatever. If a kid gets a sunburn, what should we do? Any good home remedies?
First of all, you know, treating the pain. There's usually a pain associated with the sunburn. Tylenol, Motrin, and a cool compress.
Okay. And anything else that you should do? I mean, should you run to the emergency room or?
If there's any signs or symptoms of a severe sunburn, like blistering, fever, any feeling of just feeling unwell, yes, you should seek the advice of a pediatrician.
All right. Seek the advice of this pediatrician and start lathering on before you go out a half hour. Thank you, doctor. That was very good information, especially as we head into summertime. And here, it's basically year-round. Let's